I'm Dr. John Cherian. I head the IT for SuperSonic Imagine. This is a medical devices company based out of Dubai. I'm a doctor by profession and moved into IT out of passion. Been in IT for the last 25 years now. Today it's all about AI and also the machine learning part, which is happening a lot in the healthcare space. Then there is about data sharing and interoperability. And of course, last but not the least, is all about cybersecurity and the data privacy part. Now, if you look at AI part, it is aiding in a lot of decision making and the diagnosis and the prognosis part, as well as helping in the optimization of the hospital administration part, inventory management, and a lot of other things. And if you see all the hospital environment, you see all our fragmented systems today, and getting this data with the providers and the platforms and giving a much better healthcare is a big challenging thing, and that is helping. And once we get that into place, I think that will improve the healthcare system altogether. And of course, as doing all these things, the data privacy and the cybersecurity is a major part which we have to take care, and that's critical at today's juncture. AI has already started bringing in a lot of impact, basically with respect to diagnosis and the prognosis part. If you look at in our industry or domain of imaging, AI is helping in imaging, helping in diagnosing the images much faster or assisting the clinicians in a much faster way. So that part is already there as such, or getting into a bigger shape. Now the next thing is more about building the optimization in the hospital administration system. Today, it's all fragmented things, right? And where you can get connected with the right per se and making sure that the data flows in the right way, it can help both the patients as well as the doctors a lot in making the right decisions and taking it forward. And that's where AI is very critical at present. As you know, AI has a lot of pros and cons as present today. The major concern is all about the bias and the fairness of AI. AI, the data what you feed in is what you get output, right? So the amount of data, because knowing the collection of the data happening at the deserved places or the high-end healthcare side, which will create a disparity in giving the right decision with the underprivileged healthcare side. So that is where we have to make sure that the data is balanced so that the healthcare inequity is not created in due course of time. The second thing is, the data security and the privacy part. When you see that a lot of data has to be input to the AI to give the right output, in that case, you are making sure that the privacy of the patients is not compromised in giving those data in place. Then the third part I see is about the human touch. Human touch, or I call it as now I put my doctor's hat there, the healing touch or the patient doctor, the human touch, which is very critical when comes to healing. And that's sometimes will be lost when the AI comes into big way. Another aspect is the black box concept of AI many times. The reasoning of making a decision is not clear to the clinician. And because of that, the trust of the clinician is always a big question mark. The clinicians has to trust the AI first, and for that they need to know what is the reasoning behind that particular decision which has been taken. So those things are very critical. At the same time, the cybersecurity angle is a very critical part. The privacy is a very critical part. And adding on to that, still now many of the regulatory bodies has not incorporated AI fully into that. So that is a big challenge. Once that happens, then it gets a more adoption part. At the same time, AI also has a limitation with respect to the population or the data population which has been getting collected. Another angle is, I keep telling, last but not the least, is the cost of implementing and the ROI with respect to the hospitals. They need to find that you get the right output and the patients are not overcharged for these implementations. Said that, Today in an hospital environment, you see a lot of fragmented systems. You have the EMR, you have the HIS, LIMS, the RIS, and a lot of systems. Now, once AI comes in the future, there's a big challenge to do the workflow integration, which is very, very critical, because otherwise, it will end up in again more siloed approach than a unified approach.